we were confronted with numerous patients who had had what might be called botched or complicated abortions done illegally. These patients would frequently show up with bleeding, high fevers, pelvic infections that required almost always a surgical and medical procedure with antibiotics. It was not common, but not rare, to have to do a hysterectomy, a removal of the uterus in these usually young women, mostly from non-Caucasian groups, that is African American and Latino. One case that comes to mind, which was, I think, a seminal case in my career, a young woman came in. She was septic. That means she had a body-wide infection. The infection was a Clostridium infection. That's gas gangrene. And this significantly is affected by oxygenation, the amount of oxygen in the blood. We made a determination that the best way for her to survive would be to do a hysterectomy. And we did it in the hyperbaric chamber, which gave us very high percentage of oxygen to carry her through the surgery and subsequent post-operative course. When I went into the service and came out, and I was doing my fellowship, New York State had just made elective abortion legal. This was a tremendous change. And as I was doing my fellowship and had been fully trained and working for a while, I was asked to supervise a clinic at the Elmhurst General Hospital, a city hospital in Elmhurst, Queens, which was run by Mount Sinai Hospital. And there on Saturday mornings, a group of residents, usually senior residents, were confronted with a list of women who wanted to terminate their pregnancies. Anybody who thinks that women approach terminating a pregnancy in any lackadaisical or offhanded way has another thing coming. People came into the office, whether they were teenagers, or whether they were women with children at home, women who were working, women who were no longer in the working group. They looked at this as something that they didn't want to do, but they were so grateful for the opportunity to have it done. And I am curious as to how people who are going to try to get around the laws, these draconian laws that are being passed in states around the country, are going to get around them, making physicians liable, putting them at risk for doing what they are trained and willing to do, and putting anybody who assists a patient in getting a termination. These are things that don't belong, in my opinion, in Collier County, Florida, in the state of Florida, in the country of the United States, or anywhere else on this earth. Women should have the freedom to choose when they want to be mothers and how they want their pregnancies to proceed.